us and to introduce Manoj, and then I'll hand it over to Mr. Jhalani. Mr. Manoj Jhalani is a member of the Indian Administrative Service, 1987 batch MP cadre. He's now with the WHO, the World Health Organizational Regional Office for Southeast Asia, New Delhi, and he's been here since November 2019, and he's held so many posts. He's got, when I was reading his bio, his CV, he's got such an excellent sort of education background. He's from the IITs, and then he went to do an MBA from University of Birmingham, and then he joined the Indian Administrative Service. I think it's the perfect credentials from an Indian point of view. Thank you so much, Manoj, for doing this. All the CVs and biodata are on our website. We have a special portal for the WTO the G20 conference for ICRIER. We've just had a session on the WTO, which is why I'm remembering the WTO. We've got a special portal for the speakers, the panelists, and their CVs on ICRIER's website. Please visit that. And it's my delight to absolutely hand it over to Manoj for the conduct of this excellent session that we're going to have on the pandemic and the response to it. Thank you, Manoj. Over to you.
Thanks, Rajat, for a very nice introduction. Good morning, good afternoon, and good evening, ladies and gentlemen. Welcome to the session on global health concerns, international cooperation, and role of technology. I think such a session could not have come at a more opportune time when the world is grappling with the worst pandemic in over 100 years and facing the worst economic contraction since the World War II. In terms of global health concerns, I'd like to quote from the G20 Health and Finance Ministers' joint statement on September 17. Our urgent collective priority is to overcome the COVID-19 pandemic and alleviate its health, social, and economic impacts. There have been already more than 1 million deaths. All economies are seeing contraction or slowdown, and the impact has been particularly severe for the poor and other vulnerable groups, with inequalities rising. The pandemic has also impacted the delivery of other essential health services. In late August, WHO released a report that showed that globally, countries on average experience disruptions in 50% of a set of 25 essential health services. The data show that disruptions have the potential to halt and even reverse progress on several SDG targets. We should be mindful that increase in non-COVID mortality due to TB, hepatitis, NCDs could outnumber COVID deaths in several countries with weak health systems, and therefore maintaining continuity of essential health services should remain a priority. The third area is about building better health systems on the foundations of a comprehensive primary health care and robust public health so that we make accelerated progress towards UHC and have better emergency preparedness to effectively deal with any future pandemic. Pandemic preparedness costs a very small fraction of the cost of pandemic impact and response. It will be important for countries to enhance the funding for UHC and emergency preparedness to build resilience in health and economies, even when the revenues and the fiscal space are shrinking. There are also other issues such as antimicrobial resistance and increased need for One Health approach. We all know that effective vaccines, diagnostics, and therapeutics will be vital for ending the pandemic and accelerating the global recovery. And these life-saving tools will only be effective if they are available for the most vulnerable, equitably and simultaneously in all countries. The joint statement of G20 ministers also stated, and I quote, "We emphasize the need for a global response and the importance of taking forward our collective action to accelerate the research, development, manufacturing, and distribution of COVID-19 diagnostics, therapeutics, and vaccines, including through the Access to COVID-19 Tools Accelerator initiative and its COVAX facility and voluntary licensing of intellectual property with the aim of supporting equitable and affordable access for all, which is key to overcoming the pandemic and supporting global economic recovery." It goes on to add, "We recognize the role of extensive immunization against COVID-19 as a global public good for health in preventing, containing, and stopping transmission. Now, obviously, these words are music to everyone, but it's the actions and not words that will really matter, since we are also seeing signs of vaccine nationalism in some developed countries. The WHO and partners on September 25 brought out Act Accelerator's economic investment case that argues that investment in Accelerator, which is a very innovative mechanism developed by WHO and several partners, is the world's best bet and the most viable solution for restarting the global economy. Now, let me share some statistics. As per the recent update, which was shared on the 30th September in the high level UN General Assembly side meeting, against a requirement of US dollar 38 billion for the ACT accelerator, only about 4 billion has got mobilized so far. And between 70 to 90% of the balance requirement is expected from the G20 and the OECD countries. G20 countries put in a stimulus package of over US dollars 10 trillion to support businesses and economies. Only 1% of this domestic stimulus spending contribution is needed for the global COVID-19 response, including to fully fund ACT Accelerator. The revenue losses of travel and tourism alone, just for 3 days, is in excess of 36 billion US dollars that could easily meet the funding gap for ACT Accelerator. The estimated revenue losses in international sectors over the 2 years, 2020 and 2021, is $12 trillion US dollars. Thus, there is a very strong economic case for global cooperation for improving access to medical technologies through ACT Accelerator. Although we recognize challenging to find resources beyond the ODA, particularly at a time when even the developed economies are seeing the slowdown, and yet this is just the time when they need to step up. And not only for COVID, countries should also collaborate and learn from each other, like using innovations like telehealth to maintain outpatient care and mental health services in the new normal scenario. The international community, including G20, have in recent years emphasized on the use of digital health. New predictive analytics, drawing on a wider information base and using validated machine learning, can improve real-time response capacity. Countries have used digital technologies for surveillance, contact tracing, compliance to public health measures, providing calibrated response for public health and social measures, strengthening supply chains, improving risk communication, telemedicine, capacity building, and also dealing with the infodemic. There has never been a more pressing need for international collaboration and use of medical technologies and ICTs to deal with pandemic for now and also into the recovery phase to ensure health and economic security and sustainable progress. So now let me move to the substantive part of the session. We are privileged to have a team of extremely eminent panelists for the session, and let me introduce them to you. Our first panelist is Professor Ilona Kickbusch. She is the founder and chair of the Global Health Center at the Graduate Center of International and Development Studies in Geneva. Professor Kickbusch's key interests relate to the political determinants of health, health in all policies, and global health. She is a member of Global Preparedness Monitoring Board and the WHO High-Level Independent Commission on NCDs and is the co-chair of UHC 2030. Professor Kickbusch has had a distinguished career with the World Health Organization. She has published widely and received many prizes and recognitions. She has been awarded the Cross of the Order of Merit of the Federal Republic of Germany in recognition of her invaluable contributions to innovations in governance for global health and global health diplomacy. Before I invite Professor Ilona to speak, I would wish to make some logistic announcements. Each panelist will have 20 minutes and I request them to stick to the time so that we have some time for the Q&A. And I request the audience to type their questions for the panelists on the Q&A chat box. I invite and offer the floor to Professor Ilona. Over to you.
Thank you very much, Chair, and it's a delight to be with you. In our pre-discussions, I mentioned that we'd already planned 2 meetings in Delhi and we couldn't come to India. And it might be interesting for some of your viewers that I actually grew up in India. So I have a very special relationship to your country. So I'm very pleased to have been invited. I did send some slides. I don't know if we can perhaps show them. I thought in the context of what we are discussing, I would focus in particular on the role of the World Health Organization and some of the new initiatives that have emerged. Our chair has already mentioned some of them, but I might be able to show them in an additional light. I think our chair indicated very rightly so that many are now looking to the G20 to be a strong coming together of countries to actually address the pandemic. Sadly, we must say that the G20 and the G7 have been weakened by the fact that one of their key members, the United States, has indicated that they would leave the World Health Organization, and global health cooperation has significantly been influenced by a range of geopolitical factors, particularly a standoff between the United States and China, for which the outbreak very sadly is being used as a political tool. We sometimes call the coronavirus a politvirus, because it has led to so many complicated political issues. Our chair has also mentioned the enormous financial needs that are necessary, but you can see that if there was a significant investment in preparedness, which would be around $3 per head of population, much of the trillions that we are now spending would not be necessary in terms of the enormous economic impact this has had. And so our expectations from the health world are to the G20 that they would show a similar determination around this pandemic, also in terms of the financial support, as they showed after the financial crises in 2008, because we can't address health issues without addressing economic issues, and the other way around. The Director General of the World Health Organization, if you'd show the next slide, has said very clearly, global health security is only as strong as its weakest link. No one is safe until everyone is safe. Now, it's very strange in this case that normally we would consider a weakest link some of the very poor, low-income countries. But we have seen another weak link emerge, and that is politics. Some of you might know that we have the Global Health Security Index, which actually tried to measure how well countries were prepared for a possible pandemic. At that point, people still thought it was far off. And we actually find that the two countries that were considered best prepared for a potential pandemic were the United States and the United Kingdom. And we actually see that the kind of analyses that only looks at technical capacity in response to a pandemic is not sufficient, but that the political decision-making in the face of a pandemic is actually just as critical, if not more critical. And we have seen some countries who have much less resources. Let me take Vietnam as one example. Let me take Senegal as another example, who have responded much better to this pandemic than some of the high-income countries. If we go to the next slide, you can just see the distribution of the pandemic right now. You can see where the very, very dark colors are. And you can see that India is still sort of in the middle light brown phase, even though it has a very, very high number of infections and is among the 3-4 countries in the world that have the highest infection rates. We have, and that was announced yesterday at the WHO Special Executive Board session yesterday, we have 33 million confirmed cases globally, and we have passed the goalpost of over 1 million deaths globally. And WHO says clearly that these numbers are probably lower than the reality. And their calculation is that about 10% of the global population are infected with the virus. We, of course, have an international instrument for the WHO and the countries to deal with pandemics. That is an instrument called the International Health Regulations. We have found in the course of this pandemic that these regulations are not strong enough. They do not give WHO enough authority. They don't allow it to act independently of countries. And as we speak, a special committee is meeting to actually look at the revisions needed to the international health regulations and other revisions that might be needed for the work of WHO and the work of countries. An independent panel has been established to review the actions since December of last year, to see whether some of the criticisms of China are justified, and criticisms of WHO have been put forward by the United States. And also the Global Preparedness Monitoring Board has, in its second report, which was issued about 3 weeks ago, given some indications of what might be necessary to actually improve on the global reaction to a pandemic. So as we speak, and again, some of you might know that the Executive Board of WHO presently is chaired by India, in a very important responsibility at this point in time. Actually, all these independent panels are reporting to this special session of the Executive Board. Now, some of you might remember, and if we could go to the next slide, after the Ebola outbreak, there was significant, 14-15, there was a significant criticism of WHO that it had not reached out enough to partners, both within the United Nations, but also within member states. And in response to this pandemic, WHO has increased this form of governance that we can, to some extent, call partners or platform governance. Some of us call it plurilateral diplomacy, to actually bring as many partners as possible together with a focus on countries, to support countries in terms of sharing of resource needs, of sharing donor contributions that WHO has received, of sharing knowledge and training. And of course, the regional offices of WHO, in this case, the regional Southeast Asian regional office in Delhi, would be playing a very significant role for India. And of course, all other UN organizations that are necessary are now also involved in a much, much better way than they were. And this is about a group of about 20 to 30 offices, UNICEF and UNDP, and emergency offices of the United Nations, and of course, the Secretary General's office himself. Now, after the Ebola crisis, and you can see that on the next slide, WHO did something very, very important. First of all, it established a new WHO emergency program, and this program is now leading the response to COVID-19. But when Dr. Tedros, the new Director General, took office, he established something that has proven to be absolutely essential in terms of global cooperation in relation to this pandemic. He has established a WHO Science Division. And he created a new leadership post within the World Health Organization of a chief scientist. And I think India can be extremely proud, and WHO is very proud that we have a prominent Indian scientist, Dr. Soumya Swaminathan, heading this science division and heading the responses on the scientific front of WHO to the pandemic. And you will see, if you get a chance to look more closely at some of the slides and the information, that a whole number of important initiatives have been brought to bear. I'll come to some of them, but aside from them, you know, there are new collaboratives like an evidence collaborative to ensure the harmonization of evidence, a WHO library that allows people to access information, and a whole range of fast-track review mechanisms, which are so critical right now, because we don't have the time to wait around for reviewers to spend, you know, 6 weeks to 8 months to review new research. So within this science division, if we can go to the next slide, there's also incredibly important work going on in relation to new technologies. In communication, in cooperation with the WHO Communications Division, WHO has become incredibly active in counteracting and it created a new word, infodemic. It says, as worrying as the pandemic is the infodemic, the amount of false information that is out there. And if you go to the next slide, WHO did something unprecedented. It reached out to Facebook, to Amazon, to Google, and to many of the global platforms to ensure that they help stop corona misinformation. And any of you who use any of these platforms will know that now when you search for information on the virus, you will first get an indication of WHO information asking you to go to that site. Of course, in that context, WHO is also working with a range of partners, including the ITU and others, to develop a WHO digital strategy that will be on the next slide. And here also you can see a range of communications and new developments throughout the organization. And at the next World Health Assembly later this year in November, WHO is presenting a digital health strategy. I might add that it was India who suggested that WHO develop a digital health strategy. And therefore, I think it's also very pertinent that we have an Indian chair of the executive board who is preparing this strategy with WHO to take this forward. There is a range of new kinds of partnerships that are emerging from this, and I might add a totally new world for WHO, because here there is a need to work with the private sector in a way that WHO is not used to doing. This is a very, very important governance issue. WHO is more familiar and has rules in how to work with the pharmaceutical industry, for example. And there are rules from the World Trade Organization. Intellectual property has already been mentioned. But this field of information technology, as many of you know, and some people say is a wild west out there, that is a very big new challenge that WHO needs to address, and where member states really have to help the organization. Now, going to the next slide, I would like to go to a really historical form of cooperation that WHO has established in this field of science and emergency response. It was already mentioned, the ACT Accelerator. You can see that WHO has brought together a range of organizations from the World Bank, the Global Fund on AIDS, Tuberculosis and Malaria, the Gavi, the UNITAID, the Wellcome Trust, the Bill and Melinda Gates Foundation, and many others, to work on 3 areas: vaccines, that everyone is focused on now; therapeutics, very, very important as we have to live with this virus; and something we often underestimate, diagnostics. Also in this field, India plays a very important role. You have helped develop new TB diagnostics, for example, and one of the things that is being developed is to try and have a rapid diagnostic test. Also here, the signals from Indian research are very important to move this forward. If you go to the next slide, you can already see some first achievements here. For example, guarantees to low and middle income countries for 120 million tests. Could you go to the next slide, please? Which, become more affordable. On the vaccines, there are now 9 products that are being looked at, and also India plays a role here, both in development and in production. And of course, the key thing that WHO is focused on, it was mentioned by our chair, is the equitable allocation mechanisms that are so critical. And what WHO is aiming at with all the partners, that through a mechanism I will come to in a minute, COVAX, there will be an equitable distribution also of vaccines. Before I go to COVAX, I just want to draw your attention on the next slide, a really important cooperation through the science division, and that is what is called the Solidarity Trial. This means that, next slide please, this means that throughout the world, researchers are working together on clinical trials, sharing their results very quickly, very rapidly, so that one can have the results. If you look at the next slide, which I hope will come up. Please,
it will,
next
yes,
slide.
it has.
You can actually see at the bottom that some of the medicines that are being tested in the Solidarity Trial are those medicines that the American president also was given over the recent days after his infection. If you look at the next slide, you can see that in the WHO Solidarity Trial, there are 3,500 patients enrolled. Actually, we always talk of 9 or 10 vaccine candidates because they are far advanced, but there are others, and over 100 countries have joined this initiative. I'd like to move on now to COVAX in order to stick to my time. If we can go to the next slide and the one after that, please. That is on diagnostics. I've already spoken on diagnostics. Could we take the next slide? You can see that, next slide, please, that the COVAX is, no, before that, please. The COVAX, yes, is a risk-sharing mechanisms for countries to join for the distribution of vaccines. You've already heard that one wants to define the COVID-19 vaccine as a global public good. 172 countries have joined the COVAX facilities. Sadly, the United States, Russia, and China are not yet member of that. The European Union has joined up for this solidarity undertaking. And what one is trying to do here is to ensure not only the development of the vaccine, but the production and the distribution. And if you now go to my next slide, the Indian colleagues will probably recognize the gentleman that is on this slide. What WHO is very keen to do is to have cooperation with low and middle income countries. India is absolutely central here, also as a G20 and a BRICS member. And you can see that a new collaboration has been established with the Serum Institute of India to ensure 250 million COVID-19 vaccines for vulnerable countries. This is an extraordinary initiative that is really important. I will end now with my last slide. You saw that an extraordinary amount of initiatives are coming out of WHO, but sadly, the organization is confronted with, as I already mentioned, the fact severe criticisms from the side of the United States. It is confronted with a lack of funding that makes it very difficult to both fundraise and deal with a pandemic at the same time. And therefore, it is absolutely essential that the G20 reaffirm their commitment to WHO, their commitment to funding WHO, their commitment to fund these fantastic initiatives that are underway to support countries throughout the world. And of course, the political role of India within the WHO, within the G20, within other important political bodies is absolutely essential, and of course also symbolically so essential. You are the largest, I believe, democracy in the world. What you signal is of incredible importance also to other countries. You are an important producer of medicines and vaccines, and therefore this role of India can and should be strengthened and could be a light for the rest of the world in this enormous pandemic that we are facing. Thank you very much.
Thank you, Professor Ilona, for bringing out the importance of global solidarity in the area of science and development, and also about the important role being played by the WHO and the new ways in which WHO has worked to respond to the pandemic. Now, let me introduce our next panelist, Dr. Peter Taylor. Dr. Peter has more than 30 years of experience in international development and is currently the Director of Research at the Institute of Development Studies, UK. Previously, he was Director of Strategic Development at the International Development Research Center, Ottawa, Canada, where he was responsible for leading IDRC strategic planning processes. During his 10 years with IDRC, he also served as Acting Director of IDRC's Inclusive Economies Program Area and as Associate Director for the Think Tank Initiative, a 10-year multi-partner program that supports strengthening of policy research organizations in Africa, South Asia, and Latin America. Over to you, Dr. Peter. The floor is yours.
Thank you very much, Chair. Greetings from Sussex in the UK. And firstly, I must thank the organisers of this virtual conference at ICRIER for their very kind invitation to participate at a pivotal time globally, and when the G20 role for India offers an immense opportunity for global leadership. And I'm delighted to be on this panel with the other esteemed speakers. So I'd just like to begin by wishing you all good health and safety wherever you may be at this very challenging moment. And in my 20 minutes, I won't use a PowerPoint, but I'll aim to share some thoughts on the interconnections between global health challenges, especially COVID-19, of course, and other development challenges, and the need for responses and solutions that are grounded in collaborative and collective efforts. And I'll talk a bit about the importance of research and evidence, and I'll illustrate with some examples of how my own institute, IDS, is seeking to contribute through research partnerships to building back a better world, as our chair mentioned. Also some observations on how new technologies can be both a disruptive force, which can support but also sometimes suppress opportunities for positive health outcomes. And then finally, a few quick reflections on what might be a potential role for India to support efforts to address global health concerns during its G20 presidency. So as our chair mentioned at the start, it goes without saying that the current global pandemic of COVID-19 is a health crisis of massive proportions. as we heard from Ilona, now with more than 33 million cases and surpassing 1 million deaths related to the disease, it's an unprecedented crisis for development. It's generating highly uncertain outcomes, and it's both affecting and requiring responses from all countries, albeit in different ways and to different challenges. We know that the pandemic and many of the responses to it are threatening livelihoods, economies, and societies. And reactions are exposing and potentially deepening some foundational cracks in society. It's heightening fragilities and vulnerabilities in systems of all kinds. The impacts playing out at local, national, and global scales via an interconnected world where a virus knows no boundaries. At the same time, dominant development models which have guided the world in which we live for decades are being undone and leading many citizens to feel a loss of direction and even purpose. So this is a crisis that's really demanded response from governments, citizens, the private sector, a range of different actors. And we're reminded constantly in public messaging that this is a challenge that affects everyone, everywhere. But how best to respond? So our national underpreparedness has been continuously exposed, even though there'd been predictions of a crisis like this for some time, notably following the SARS epidemic of 2 decades ago. And our readiness collectively to respond has been influenced by many factors, including, of course, pressing challenges posed by conflict, disaster, and their human fallout. Humanity, which we're all part of, has many shared preoccupations with other major global challenges, including climate change, migration, inequalities. The list is very long. So against this backdrop, the arrival of COVID-19 on the global scene was quite stealthy. 1 year later, it's probably the world's greatest single preoccupation and one which we will be facing for the foreseeable future. Now, while the world's leaders and nations try, with varying degrees of success and commitment, as Ilona already noted, to contain the negative impacts of the pandemic, we're also reminded that crisis brings opportunity. And in addition to identifying the most urgent strategies and generating approaches to address short and mid-term needs and challenges, this is a time of opportunity for a genuine transformation of ideas, of policies, of programs and practices. And we're actually seeing seeds of hope emerging for radical transformation of development in the context of the current crisis and beyond. And there's a sense of collective urgency, again, as Ilona has just been illustrating, in fostering collaborative and comparative learning and practice across the experience of different countries and localities, and in finding ways to avoid returning to conditions that do not serve us well. And as we heard from our chair, this may all be encapsulated in the overall notion of a systemic transformation of building back a better world, a world that in the future will be different to the one that we've collectively shaped until now. And the COVID-19 crisis is also a stark reminder of the interconnectedness of all of our lives. It highlights we're indeed global citizens facing a universal challenge. And as with the climate crisis, we're all affected by COVID-19, but these effects are disproportionately felt by those least able to withstand shocks. Those living in lower middle-income countries are particularly at risk. Many of them already have weak health and social protection systems, and even prior to this crisis, faced high debt burdens. Many of these countries also bear the brunt of external risk, such as climate change and political instability. And countries already experiencing humanitarian crises and fragility, hosting large numbers of refugees, struggling with inequalities, these will be hugely impacted by the health pandemic and the economic pandemic that's only now starting to truly reveal itself. Now, a very recent IDS Knowledge for Development report on social impacts and responses related to COVID-19 in low and middle income countries quotes a UN statement which again affirms that health needs are connected to social, economic, and environmental well-being, and there's a strong environmental sustainability and gender equality imperative to building back better. And this Knowledge for Development report highlights several major areas of impact of the pandemic. Poor and near poor people are at greatest risk of extreme poverty. Marginalized groups are most affected, and their voices are often not heard due to closing civic space. There's limited, inadequate, or no social protection. Women and girls are most affected, and there's a lack of disaggregated data that serves to further exacerbate exclusion. And the report's main conclusion is that long-term universal social protection and protection of health, economic, and social rights are the best defense against global pandemics and their fallout. Now, interestingly, not surprisingly, and perhaps worryingly, these impacts align quite closely with the recommendations made in the 2018 paper, SDGs, Health and the G20, A Vision for Public Policy. I see Ilona smiling, authored jointly by a group that included Ilona, Ali Mehdi, myself, and other colleagues from the Think SDGs network. And this policy paper, which was intended as a call to G20 governments, arose out of the T20 discussions in Bonn, Germany, led so inspiringly by Dennis Snower, who I know is also participating in this conference. And we highlighted in that paper that ensuring health for all remains a persistent and an entrenched global challenge. And we observed that G20 governments are in a position to elevate the priority accorded to health and need to acknowledge the centrality of health to attaining the SDGs. And we called, in that time, on G20 leaders to build nations that are more inclusive and less divided by adopting a health in all policies approach, prioritizing the most vulnerable, engaging citizens in policy processes, and filling health data gaps. Now, although this was published almost 2 years before the pandemic, the abundant evidence of who is now suffering most from the impact of the disease seems to reinforce the relevance of those policy responses that we'd called for in 2018. So given the evidence accumulated over so many years of who is at greatest risk of being left behind, seeing us lose ground on many of the advances made previously towards achieving the SDGs, and now faced with a truly universal challenge that affects every single one of us, this seems a hugely important opportunity and a critical moment for India to play a significant role in taking the global agenda forward through its G20 presidency. Now, I believe, perhaps not surprisingly given I work in a research institution, that research evidence and data make an enormous contribution to making progress in relation to these challenges. And my colleagues at IDS are constantly emphasizing ways in which technology can assist in ensuring that evidence and data is collected, made available efficiently and effectively, and gets into the hands of those who need it and can use it. And to help meet the evidence needs associated with this response, a wide array of research is already being carried out, as we've heard already earlier in the session. And much of this, again, as Ilona mentioned, is looking at the deeper dimensions of power and politics that often determine what responses are chosen and how these play out in practice. And from IDS's perspective, we keep emphasizing that further work is still needed, particularly engaging researchers from the social sciences and the arts and humanities, working collaboratively and collectively. And there's an urgent need for identifying, supporting, and learning from innovative creative work, the findings which are rapidly and effectively synthesized, summarized, and made available. So effective communication is also critical. Now, just to share just some brief examples of how we've tried to approach this at IDS, we're really trying to prioritize working in partnership, and this has enabled us to respond to COVID-19 through several avenues. And I liken it a bit to the experience of the last few months, a bit like passing through a hurricane. Certainly in February, March, and April, it felt as though we were really in the earlier days of the pandemic and really in the heat of the storm. And then currently it felt as though we'd rather been in the eye of the storm and had a period of relative calm. But in the UK, it seems as though we're actually moving back into the next wall and we're feeling the force of the blast again as numbers of cases and unfortunately deaths start to quickly rise. So how have we been trying to respond through our research agenda at IDS? Mainly in three ways. Firstly, generating social science research and knowledge responding directly to the pandemic. So for example, our social science and humanitarian action platform is supporting COVID-19 response partners, which includes governments and other actors, by mobilizing networks of experts and through the production of evidence briefs, which particularly highlight the sociocultural considerations relevant to the control of the disease. And so cross-cutting themes are the political economy of the epidemic, diverse forms of knowledge and experience, state-society relationships, history, and context. And these briefings have covered topics as diverse as the impact on home and community-based care, on management of the pandemic in marginalized populations, how COVID-19 is playing out in contexts of conflict and displacement, shielding people at high risk of severe outcomes, why prisons are a particular risk, dying, bereavement, mortuary and funerary practices, informal urban settlements, and quarantine. And obviously all of these have in common that they involve social phenomena, which are really important to understand. We also have a pandemic preparedness project that's looking explicitly at preparedness and response to COVID-19 at local, national, regional, and global settings with a focus on Africa. And that's exploring preparedness from below in relation to themes including uncertainty, emerging knowledge and expertise, and relationships between communities and authorities. We also have a sanitation learning hub, which is looking at sanitation and health in high population density urban areas. And interestingly, they're just about to publish a compendium on hand washing practices, which clearly are massive challenges in high density urban areas. But we're seeing practical approaches being developed on the ground by local communities, and they're being shared more widely through peer-to-peer networks and knowledge platforms. And we also have a Knowledge for Development programme, which provides a help desk function for the UK government, and they've been extremely busy generating knowledge syntheses and reviews on various topics relating to COVID-19. And all of these examples of all this material you can find on our website. I'm happy to provide you with that link afterwards. Secondly, we've also been engaging in a range of research on secondary impacts from the pandemic. So, for example, looking at the evolution of health systems, the role of the market and private sector in likely future responses to the pandemic, the present and future role of China in global governance and international development assistance, particularly in the arena of public health. We're looking at state-citizen relations, for example, where and how community-led mobilization and innovation may be taking place at a time when formal institutions and safety nets are failing, yet space for public debate and dialogue is also being constrained. That may be through state-sponsored crackdowns on citizen movements or through the use of digital technologies to monitor people in ways that lead to injustices of different kinds. And we're developing greater understanding of how those who suffer most from inequities and inequalities, poverty, reduced access to health, water and education, and experience the greatest hardships of climate and environmental change are also suffering the greatest impact of COVID-19, and in turn, in the future, will experience further injustices from the economic and social fallout. And thirdly, we're initiating research that looks forward towards building back better. For example, we're working with Irish Aid and the Foreign and Commonwealth Development Office, providing them with syntheses of responses to COVID-19 to help them shape their immediate response, but also offering a series of inputs on how to build back better beyond the immediate impact of the pandemic. So we're really asking fundamentally, how can we use the crisis to help us reconfigure the trajectory of development and to help bring about sustainable transformative change? For example, green economic transformations and low carbon pathways, addressing exclusions, injustices, inequities, and inequalities of many kinds, looking at social protection, looking at food systems, strengthening empowerment and voice of citizens and communities, including through the use of digital technologies as a means of tackling closing down of civic space. And also questioning the role and purpose of local, national, and international institutions and how they may need to be reinvigorated, and in some cases reimagined, if there's going to be much greater trust and accountability within those institutions and with citizens and communities. Now, all of these initiatives are taking place with resources provided by different funders who are committing funding, effort, and energy into this work, and for whom collaboration is also really important. For example, Foreign and Commonwealth Development Office of the UK, the Wellcome Trust, Swedish International Development Agency, IDRC Canada, Irish Aid, Bill and Melinda Gates Foundation, Swiss Development Corporation, to name just some of our partners. But we know that these collaborations only work when we have active research partnerships that are built on solid relationships, trust, and openness, to learn from each other about what's happening on the ground in different contexts, and to share their approaches and findings to support and catalyse a common effort. And just to add that these partnerships are not only involving researchers and academics, they also involve real engagement with governments, policy actors, international agencies, and decision makers of different kinds, NGOs, communities, and the private sector. Now, just a word on the role of new technologies in all of this. And we know that new and disruptive technologies are generating transformations in entire systems of production, management, and governance. And the speed of current breakthroughs is without precedent globally in artificial intelligence, robotics, sensors, gene sequencing, neurotechnology, quantum computing, and 3D printing. And health is at the forefront of the application of many of these technologies. But what makes this upheaval different from previous ones is not only the pace of change, it's also the convergence of technologies transforming all facets of society and development. And the world in 50 to 100 years from now will owe a lot of its character to how we think about, invest in, and govern these powerful new technologies. But the Global South, and in particular lower income countries, are not as engaged as high income countries in the development and application of new technologies, but they will be as or more affected by their disruptive character than high income countries. and potentially disruptive technologies such as AI present both opportunities and challenges for lower middle income countries. Shaped the right way, they can advance any of the SDGs, including the delivery of health, for example, through telehealth and vaccine development, and also by enhancing education, agriculture, and economic opportunities. Harnessing the potential of technologies to deliver health, democratic, and economic well-being for poorer communities remains challenging, but with scope for really high returns if the institutions and funding required can be secured. But while the development of disruptive technologies holds the potential to better the lives of the poorest and the most vulnerable, many of them come with challenges that also need to be mitigated. AI and other technologies are proving effective at improving health outcomes, generating economic opportunities, and eliminating laborious tasks in production settings such as agriculture. But changes to the world of work may destabilize social and economic systems, which then leads to increased fragility and inequality, and which in turn may exacerbate health challenges. So without effective governance or policies to govern its ethical use, AI presents serious risks to civil liberties, human rights, security, and democracy. Development and application of advanced technologies by lower middle income countries will be needed to promote better health, sustainable and global competitiveness, whilst ensuring the poorest and the most vulnerable are not left behind. So as we look forward to an uncertain future, many responses are already being made to the challenges that face us and the opportunities that continue to emerge. But clearly, there's much more effort still needed. So in conclusion, I would like humbly to propose 3 key areas in which I believe India, through its presidency of the G20, can make an enormous contribution. Firstly, by helping to raise awareness of the need for an integrated, holistic, and systemic approach to developing policies that seek to tackle global health challenges. And in so doing, emphasizing that these policies should prioritize the most vulnerable and those who are most likely to be left behind, whilst engaging citizens in policy processes about the problems they're experiencing and in shaping the solutions to address them. Secondly, by pushing for efforts to fill health data gaps and advocating for more support to the generation and use of knowledge, evidence, and data to help tackle the pandemic and its impacts. And this is going to need inter and transdisciplinary research, which is solution-oriented, particularly seeking solutions that address the needs of those most likely to suffer from its consequences. And this has implications for promoting, incentivizing, and facilitating partnerships of different stakeholders, from policy and decision makers, researchers, civil society and communities, the private sector, funding agencies, working together using the technological tools at our collective disposal to build back a better world. And thirdly, with its huge comparative advantage in the development and use of new technologies, India can play a lead role during its G20 presidency by calling for policies and regulatory solutions that enable ethical and inclusive scaling of technologies at national and global levels to meet health, educational, and governance needs, and by taking a lead in ensuring that the most vulnerable groups in lower middle income countries have the skills, the opportunities, and the social protection to thrive, be healthy and safe in a future which is going to be inexorably shaped by technological advances. So thank you, Chair, fellow panelists, and to all participants for this opportunity to share these thoughts with you today, and I look forward to the discussion.
Thanks, Dr. Peter. Thank you for bringing out the interconnectedness of our lives, interconnectedness of health with other social and economic sectors, and pointing out that the crisis also brings out opportunities in transforming policies and programs, and how IDS is contributing to both knowledge creation and dealing with the pandemic and building back better, and also for pointing out what India could do as G20 chair. Thanks for all that. Now, I can just remind the audience that they can put in questions on the Q&A. And now let me introduce our last panelist, Dr. Praveen Gedam. He is the additional CEO of the National Health Authority that is responsible for implementing the largest health protection scheme in the world, PMJAY, Pradhan Mantri Jan Arogya Yojana under Ayushman Bharat. He is an Indian Administrative Service Officer and is second in command at the NHA. Dr. Gedam is a go-getter. He is known for turnaround in the MCH indicators in the Latur district, which is one of the most backward districts of the state of Maharashtra, through targeted interventions and systematic medical checkups, etc. And between 3 years, 2006 to 2009, his 3-year mission led to considerable increase in deliveries at hospitals, been going up from 48% to 93%. In 2015, Dr. Gedam oversaw the organization and management of mega event Kumbh Mela, which is the third largest human congregation on earth. And that event was a huge success, setting an unprecedented record of zero causality, zero epidemic, zero missing person, a feat which drew the attention of top management institutions and research organizations. So with that, over to you, Dr. Praveen. The floor is yours.
Thanks to organizers and Mr. Jhalani for having me here. Even though the National Health Authority is well known for implementation of Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, which is world's largest government-sponsored health assurance scheme, since the topic of discussion today is technology, I would like to focus on another important initiative of the National Health Authority, which was recently announced by the Honorable Prime Minister on Independence Day speech, and that is the National Digital Health Mission for India. So we are using tech extensively in Ayushman Bharat, no doubt, but now we are looking forward to create a digital health ecosystem in India, and I will run you through a quick presentation in maybe 10 minutes. After that, I can take questions as well. Hope it is visible. Yeah.
Yes, yes, it is.
So briefly, I will tell about NDHM and what we have done so far, and then what we plan to do. See, remember this was announced only a couple of months ago on 15th of August. And we can start the journey from obviously all major initiatives. We can start from SDGs, but the National Health Policy of India released around 3 years ago, it talks in detail about the use of digital technology, and the further detailing was done in the National Health Stack released by Niti Aayog, the policy think tank of Government of India, based on which, after extensive stakeholder coordination and collaboration, National Digital Health Blueprint of India was released, and this describes the way forward for a country as diverse as India. And more important to remember is that in India, health is a state subject, a provincial subject. So it becomes all the difficult for creating an ecosystem like this. The NDHM is essentially an implementation of this particular blueprint, which we have started a couple of months ago. We are envisaging to create a state-of-the-art digital health ecosystem in India, which will obviously improve the quality of health data collection, provide a platform of interoperability, provide updated and accurate health registries, I will describe in short, and of course, ultimately leading to better quality of health care. As a principle, as a policy, government has decided not to make it mandatory, but to make products so efficient, effective, that everybody will end up getting the one. So it's opt-in kind of model and not opt-out or mandatory. The privacy and security, obviously health is a very sensitive data, and this is a prime area, so it's inbuilt in the design. We will try to be inclusive. So there are large parts of India where connectivity is still an issue. We are trying to have modules like offline modules and some other ways to get things integrated there. Ultimately, what we are trying to have is a seamless portability in terms of data structure, that is syntax and semantics, and as well as from connectivity point of view. And the focus will not only be on treatment, but on overall well-being. The architecture, this is also very important for a country as diverse and as large as India. We do not intend to have central repository. and this is also important to address the concerns about privacy. The health data will be stored where it is stored right now. What we are planning is just to connect all these islands, if I can say, islands or some isolated servers with each other. You might have heard about UPI platform of in the finance sector of India. This is something similar. Now we intend to provide NDHM platform which will connect all the health service providers. The only thing that will be centralized will be a registry of doctors, registry of facilities, and registry of health IDs, the citizens. So this gives a simplistic picture of that. We have 3 registries in the center. On left hand side, we have health information providers, places and systems where health information will be generated. And on the right hand side, we have health information users like individuals and doctors who will use this information, and it will be the information will be passed only through consent manager. So this is an electronic system, an important feature. And patient will have choice to give limited or partial consent and withdraw the consent already given. So the master of data will be patient. Now this describes things in brief. Again, on the left hand side, you see 3 basic registries: registry of individuals, health IDs, registry of doctors, and registry of health facilities, hospitals, labs, and clinics. They will be centrally located to give the unique identity. And electronic medical records which get generated in various health institutions with various doctors, they will be linked to single health ID to create a longitudinal medical history in the personal health record of the person, which shall be accessible only to that particular person. So that is the next module. And obviously we are also developing modules for telemedicine and e-pharmacy, which will ride on this basic core fundamental building blocks. So we have some regulatory provisions. Most of them are now in place. The health data management policy is under finalization. This will be finalized before we operationalize the network called NDHM. So far, we have had extensive stakeholder consultations, and they are ongoing as well. We have interacted with more than 1,000 stakeholders so far. It's an ongoing activity to take their inputs and understand their concerns, and constantly trying to evolve the system. The health ID module is live in pilot 6 territories of India, and more than 150,000 IDs have been generated so far. It's a very simple process. You have option to link or not to link it with your Aadhaar. You use either your Aadhaar number, which is a national ID of India, and or with the mobile number. Then the module of doctors is also live. So this will bring doctors from all systems of medicines, including Indian systems of medicines, and in the later stage, other paramedical workers and allied workforce as well on single platform. Again, this will solve the problem of KYC when it comes to things like telemedicine. Then health facilities, there are around 1 million health facilities in India, including pharmacies. So we have started bringing them on board so that people can connect with the facility of their choice. Consent manager, as I said, is a very important element, because every request for seeking health information will pass through this centralized consent manager. Electronic medical record applications, there are enough number of applications in the market being used by various doctors and healthcare providers, but we are also providing one low cost solution for particularly to those who cannot afford costlier options. But we shall be allowing integration of all existing EMR applications which are being used in various parts of country, so that there is the data from one EMR application in hospital X can be accessed by Dr. Y in hospital Z through the consent manager with the consent of the individual. Telemedicine platform, we are in the process of building a public platform. We already have a e-Sanjeevani platform for public hospitals, but we want to develop it further so that it can connect the private doctors as well, so that teleconsultation can be provided and prescription can be provided. So far, as I said, we have implemented these 3 core registries in 6 union territories, and once the data policy is finalized, we will roll out other modules and further expand the scope of services, and will expand it in other parts of India. Obviously, at the end of it, what we are looking forward is as follows. Citizens will have access to all of their medical records, which is not the case right now. Even if you ask any random person on the street about his history of immunization, probably 99% of them will not have any record about their own immunization. So that is a major lacuna in the system, and obviously we know there is a lot of repetition of tests because we sometimes lose papers, and there was some discussion, some study in one of the seminars I was told around 30% of medical records are not available to doctors when the patient comes to visit and take consultation. Citizens will also have benefit of selecting hospital and doctor based on accurate information. Again, this is very important in country like India, where there are a lot of fake doctors, quacks. So this will take care of that issue. And obviously ease of connecting with doctor, the access issue will be tackled. For doctors, the advantage will be having a complete medical history at one place, and repeated tests will be avoided, remote consultation will be possible, unnecessary physical contact will be avoided, and we are also trying to have modules to improve the ease of doing for healthcare, so that all the permissions etc. can be given on a click of mouse, so that the red tape in setting up and regulation of the hospital is avoided. For policymakers, as I told, the data will be strictly personal but anonymized and aggregated after removing all personally identifiable information, and after formulating relevant rules and policies, we can see that the data of 1.35 billion people is a rich data, and such anonymized aggregated data can be used for research in medical science and public health and epidemiology and health economics and similar other areas. It can be used for monitoring and evaluation and develop suitable policies, and we are into the middle of one such medical public health emergency, and one can imagine the kind of advantage that this kind of data can give to develop various policies to tackle, let us say, COVID pandemic. So in fact, we have already started discussion in anticipation that COVID vaccine will come in few months, of how to make use of this digital backbone of NDHM to ensure smooth and good management of COVID vaccination whenever it comes. So that discussion has already started, and I think the list can be endless. The research opportunities, I can see they are endless. We already are discussing with various specialists. Couple of days ago, we had a discussion with Indian Joint Society of taking their registry of implants on our platform, so that we can analyze the results of various types of implants in joints like knee and hip. So the opportunities are endless. We have just started the journey couple of months ago, and we look forward to develop this platform in a better way, in a collaborative way, with the inputs from experts like you, and look forward to use this in the future. Thank you so much, and I can take questions if any.
Thanks, Praveen. You brought out the features of recently launched National Digital Health Mission and how digital technologies hold potential to transform healthcare while ensuring privacy and data security and improve research, etc. So it's now time for question and answer. It's 5:10. We'll have for 15 minutes or so, we'll have the question answers. The question answers are there on the Q&A as well as on the chat box. So may I now request the panelists to pick up the questions? I mean, starting from question number 1. Will I request Ilona to take a shot?
Here I come. The one about Lancet. It says here the Lancet editor. Is that the first one?
Yeah, that's one. So
Yeah,
I'll
okay.
read out the
Yes,
Lancet.
I'm very, very happy to take that up because I think most public health people would actually agree to that. I think, you know, in even historically, if we go back to great men of global health, of public health, like Rudolf Virchow in Germany, all of them said, you know, any disease outbreak cannot be understood without poverty, without social dimensions, etc. I think in terms of this endemic today, of course, we are very aware that we are not only talking about all these social determinants, and of course, Peter made reference to many of those, but we're also talking around environmental and ecological determinants. If we look at the origins of, you know, the various new viruses that we are confronted with, that is very much related to how we deal with our natural world and how this link between animals and people is being defined in a new way. Now, the speaker here speaks about malnutrition, and that, of course, leads us into the whole area that of determinants like having access to good food. And David Nabarro, also one of the key proponents of this agenda, has drawn attention to how important addressing food security is in the context of a pandemic. And we have seen, you know, as poverty rises, the access to food also becomes much more difficult. People can't afford it, farmers can't go on their fields, etc. So what's important here is that the WHO work with the other organizations, and it is working closely, for example, with FAO, also on the One Health initiative. It's very important that organizations like the G20 or the European Union or the African Union, we could take many of these political bodies to actually be clear about this interface. You know, where must the key investments be? And definitely giving access to good food and nutrition must be an ultimate priority. And of course, it is already that also in the Sustainable Development Goals. So I think all of that comes together. Last point, perhaps, in the COVID-19, one speaks a lot about these preconditions. And of course, in the developed world, people think about obesity and they think about a whole range of non-communicable diseases. But of course, for low and middle income countries, and particularly the low income countries, being malnourished, being hungry, having, you know, no reserves in terms of your health and your body is one of the major preconditions of contracting disease. And that, as I think one of the speakers said, goes far beyond COVID-19. You know, that applies to tuberculosis, that applies, you know, to so many other health issues that we have to deal with. So I think Richard Horton, the Lancet editor, has given a very strong message about this endemic. But of course, like Peter said, it needs that kind of health in all policies approach. And we would hope that the G20 is willing to take that up, just like there were meetings between health and finance ministers. Maybe we need to have more meetings like between health and agriculture ministers, health and digital ministers, and you know, you can expand that into a whole range of ways. And maybe India can find some new way of addressing that health in all policies during its presidency. Thank you.
Thanks, Ilona. I think there are other questions also, and probably since you were the real champion for WHO, the second one is why hasn't the WHO so far put out a detailed framework for COVID-19 public health surveillance. At the moment, all we have is the interim guidance of 7 August 2020.
Well, that's already, relatively close. Maybe you can actually even say more about that. But WHO is very, very careful with, final guidance, particularly in such a rapidly changing field as COVID-19. We are only learning about the virus. We're only learning about its various transmission rates, etc. So I think right now in COVID-19, it is very difficult to say anything is final. And I think, that is one of the reasons WHO is very careful here. Also, of course, the situations in countries are so different, context matters. And that, I think, would be my answer, but maybe our chair will have some additional information. I think the next question Peter has partly referred to, and actually the independent panel today speaking to the executive board was very, very clear that one of the key investments for preparedness is universal health coverage. There's just no question about that. And of course, universal health coverage is not just having the facility to treat, but it includes the prevention, and it includes something that has always been neglected, and that is the public health infrastructure and the public health functions. So I think that is becoming a very, very clear message. WHO makes that message, but more and more reviewers are also making that message. But as I think one of the other speakers, I think it was our chair who said, we face that fiscal contraction right now. So actually, just before COVID, we saw a very, very slight increase, but a positive increase in public investment in primary healthcare and universal health coverage. Of course, now with COVID-19, we've had that contraction, and therefore it will be so critical that international bodies, national governments, but also the development banks, etc., allow countries to invest in their universal health care. And there, of course, one of the calls is for debt cancellation. And I do think that could be an issue for, depending, how long this discussion goes. We would hope that already during next year's presidency that is taken up. But if not, I think this is an agenda for India, really debt cancellation so that countries can invest in their healthcare systems. Thank you.
Thanks, Ilona, for taking on so many of the questions. I think there's one question, I think the fourth one, which is specific to India. Praveen, you would like to take a shot at that?
Yes, I can. So I don't think the issue of, the question is about how will you manage finances and HR for this initiative?
Yeah, so let me read out. There's recently been a lot of discussion around the digital governance of health data in India. How's the government planning to address the related challenges of financing and manpower? For example, NCDC does not have units in all states and districts. There have been severe shortage of manpower. They've given an example of NCDC, but basically challenges of financing and manpower. Over to you, Praveen.
I would like to tell that the cost of initiative as far as government of India is concerned to set up this platform is less than even 200 crore rupees. That's not a big amount, I think, one. Secondly, there already are EMR systems or HMIS systems being used in various hospitals. What we are planning is just interconnecting them, that's all. So that records in all hospitals are available at one place after the consent. So that's all. There is no other additional investment concerned. Of course, there are some areas where additional investment will be required. For example, there may be a smaller hospital or a clinic where right now only paper-based medical records are being prepared. And when we want to go for digital system, we will have to have some hardware and basic software, which should not be costly. And in case of extremely those facilities where number of patients are very high, maybe some additional manpower to digitize the data which gets generated. But that is also going to provide an advantage which far outweigh the minuscule investment that we are planning right now. And I have visited a certain district hospitals with the OPD of around 4,000 per day in one of the smaller places, small towns. So, and they are managing their digital data with the manpower which they already have quite well. We just want to connect such islands of excellence and create more islands of excellence, so that digitized system in place. Manpower and finance is absolutely not an issue.
Okay. Thanks, Praveen. And the last one, I think there is one on the chat. So I would request Dr. Peter to, it says, as in the case of G20 follow-up after 2008 crisis for establishing mandatory benchmarks for regulatory framework, what would the panel recommend in terms of an analogous G20 relationship with WHO and other agencies for benchmarks for international healthcare infrastructure to respond to such crises in future due to their greater likelihood? Peter, you would like to take a shot at this?
Well, I can take a quick shot, but I would also just, if I may, just really quickly go back just to complement what Ilona had mentioned to a couple of the other questions as well. And actually, these are timely questions because several colleagues of mine have just completed some really useful briefing notes, which we just launched this week, actually. If anyone's interested, they're welcome to look on our website at ids.ac.uk. And we basically have provided some briefing notes which look at public health responses to COVID and also the impact of COVID-19 on governance, on social protection, on gender, and also on food systems and food equity. So I think they're quite interesting to read because they're grounded in a good review of the literature and a lot of practices as well. On the food question, I think it's a really good question. I think it is relevant actually for G20 consideration, because one of the points my colleagues made in their paper on food systems is that the ability for many people, especially in lower middle income countries, to not only access food but to also produce food and to have this sort of agency to access and produce good, nutritious food is not just about being educated about why good food is important to eat. It's actually about changing the structural and system-wide issues which maintain the sort of prevailing economic order. Fundamentally, these are economic questions. How do you prevent monopolization and oligization of the food industry by a small group of companies who basically skew the ability for small-scale producers, small-scale enterprise, people within their own domestic contexts of entering the food value chain? And that's a structural question. And this is where, given the economic considerations of the G20, I think there's really room to enter into conversations here about how it's possible to actually look at the structural conditions which determine the extent to which people are able to actually access food which is produced in more diversified consumptions, more open trade, and more equitable systems for production. And also, again, learning and using innovation systems and institutions which support markets emerging at the local level. Because I think many people can't access food because they don't have control over the means of production. So I think that's an area where the G20 is able actually to contribute. I think also the discussion about UHC, Ilona has said very, very well where the challenges there lie, but all in terms of financial issues, there's a huge issue now around social protection. How will people currently being supported or not being supported at all fare in the next few months when even the economic provisions which have been put into place are removed? We can see even in my own country, discussions about furloughing schemes that will come to an end. We can see that people all over the world are going to be suffering really from the economic pandemic, which is going to follow very rapidly on the heels of the health pandemic. And again, I think these are questions about how to raise the revenue and where the resources will come from to fund the essential nature of universal healthcare and wider forms of social protection is huge. And again, many of my colleagues right now are looking at taxation. Perhaps taxation is not the first thing that we think about when we think about tackling the economic fallout of the pandemic, but they're demonstrating that there's huge wealth which currently is being untapped in many national contexts because tax collection systems basically are not functioning in a way which allows that wealth to be brought back into the domestic budget, which then can make more funding available for use for funding, for example, universal healthcare and social protection, as well as obviously global commitments, which are also equally important. And I think these are G20 considerations. I think there are areas in which the G20 can act, can make a difference, and really promote practices and ways of changing the rules of the game. And I think that India's presidency is a great opportunity to do that. On the question on establishing mandatory benchmarks for a regulatory framework, well, again, I think the 2008 crisis, of course, is in relation to a major economic crunch again. And I think it's in this economic domain, these economic determinants of health, where it's possible for the G20 to actually play an important role in trying to understand, what would be the implications economically and how could the G20 actually help again to shape the rules of the game, influence the structures which govern the global economy, which would then allow for responses which address the health challenges. In terms of that relationship with WHO, I think Chair, yourself and Ilona probably would be better placed to be able to sort of say, well, what would that look like? But it clearly has to be complementary. The danger is, of course, creating separate parallel tracks that don't speak to each other. And this is an area where I think we're just seeing very, very clearly the interrelatedness and interconnectedness means that whatever bodies are established to look at regulation need to work together and join up their efforts. Thanks.
Thank you. I think we have come to the close of our session. So, I think our panelists have covered significant ground on the subject of global health concerns, international cooperation, and role of technology. The talk was thorough, insightful, and engaging. It brought out global interconnectedness and the importance of global solidarity and the critical role of political leadership. It also brought out the importance of interconnectedness of health and other social and economic sectors and need for looking at holistic interdisciplinary solutions based on research and evidence. We also looked at the National Digital Health Mission architecture in India that promises to use digital technologies to transform healthcare and facilitate continuum of care. I think there has never been a more pressing need for international collaboration and use of technologies and ICTs to deal with the pandemic for now and also into the recovery phase to ensure health and economic security and sustainable progress. I would like to take the opportunity to thank our distinguished panel and also our participants. Thank you so much for joining in and providing the insight. Over to you, Rajat. Thank you.
No, this has been a fascinating discussion, Manoj. Thank you so much for moderating it excellently. And Ilona, and Peter, and Praveen, they were all excellent. I think we couldn't have asked for a better session. And this has been such an important session. So I'll request all of you those of you who use slides to send them in so that we can put them up on our website. Because what happens in a lot of our seminars is that people will go back, people who have attended will go back and look at the slides and look at your discussions. And also people who haven't been able to do so because of other preoccupations would actually go and look at the slides and the discussion and also the video feed that we will be putting up on the website. So please send in your slides. I know Ilona has already sent in. Praveen, if you could send in your slides, and we're happy to put them up on the website for people to engage further.
Yeah.
Thank you so much. And it has been such a fantastic session. Thank you. And look forward to engaging with you once more.
Thank you.
Bye-bye.
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 Have a good day. Stay happy. Stay safe. Bye-bye.
Bye.
And you. Thank you. Bye-bye.